Patterns of drinking have changed a lot over the years. Nowadays, most alcohol is not consumed in pubs or in public places. It's consumed in the home, or tragically sometimes in public spaces, such as down in the park. And particularly heavy drinkers become very sensitive to the price of the alcohol. They will, if you like, step down so that they're spending the same amount of money but getting more alcohol for their money. And there's been rightly a lot of publicity over the last decade or two about very cheap alcohols, particularly very cheap cider, very cheap vodka, and the damage that that alcohol can do for very low spend is scary. The heavier drinkers, particularly dependent drinkers, rely on and concentrate on the cheaper alcohols. It makes common sense that they do that. So what do I think about the legislation, which of course is enacted, but it's an act of Parliament, but has not yet been introduced because of challenges from the drinks industry. Do I think the minimum unit pricing, as it's become known, would be effective? I mean, I feel very passionately about this because I'd like to think that as a doctor I can approach the evidence impartially, and the evidence is overwhelming that in every culture, at every time point, there is a very strong link between alcohol consumption and alcohol-related deaths, and between alcohol consumption and the availability of alcohol. And the availability of alcohol is a balancing act between one's disposable income and the price of alcohol. So price is an absolutely crucial determinant of deaths from alcohol-related liver disease, or deaths related to alcohol in general. The two ways that you can influence price are by taxation, or by this novel idea of setting a threshold below which alcohol should not be sold. Here in Scotland, we don't have powers to influence tax, but even when tax has been used, it is effective, but it's a blunt tool because it affects everybody. Minimum unit pricing very selectively targets the heaviest drinkers because they're the ones who are drinking the very cheap alcohol. You couldn't invent a better public health policy. I hope it's become clear that although I'm spending my professional life looking after people who have advanced liver disease, the solution to alcohol-related liver damage doesn't lie in the hands of doctors like me. This is a public health issue, and prevention rather than cure is what we need. If I as a doctor could give one message to people who are at risk out there, it's to realise that these safe limits that we talk about for alcohol are real, and alcohol drunk to excess is damaging your liver even if you're feeling fine. This is a silent illness until it's too late.